going to look into this in the future quite dramatically because I don't believe that women's formula should be different than men's formula. Testing. I'm going to move pretty fast. Unfortunately, this is about a 40-minute talk, and I'm going to cram it in here. There's 7 different tests out there. The companies are trying to meet the needs of the patient and say, listen, okay, I'll buy the argument you want to be an individual. I'll show you a test, and I'll give you a test that will show you exactly what brand you should buy. Hair analysis. Hair analysis is one of the first, one of the easiest. It works for some things, however, it's terrible for vitamin and mineral analysis. In fact, I wrote that it should be criminal, and it turns out that the guys that first developed this are in jail. Urine analysis is interesting, it's easy, certainly non-invasive, but it's just not helpful in determining specific vitamins and mineral deficiencies. Saliva testing, just the same, works well for HIV, cancer detection. Even our women's hormone program, we use a lot of saliva testing. It's just terrible for vitamin and mineral testing. Pharmanex came out with a scanner. It's a green box. You put your finger in the blue light. It gives you an antioxidant reading. This is one of the most popular companies in America. They're probably #1 in the market. And they tell you if you put your finger in that blue light that you're going to get antioxidants. Well, I may be a genius, not be a genius, but I can tell you everybody needs antioxidants, and you don't have to put your finger in the blue light. The truth is, once you get the answer from this test, you get the same generic vitamin as if you didn't take the test. It's all marketing. No science. GeneLink and Solver, both good companies, now doing DNA testing. You say, listen, I'll analyze your DNA, and I can tell you what might happen to you in your lifetime as far as your mineral and vitamin needs. That kind of information is absolutely worthless. That's like saying someday you may die of cancer. Someday you may get hit on a car on the highway. What are you going to do with that? It's not predicting deficiencies. It's just giving you some guesses of what might happen to you in life. The truth is, once you get this whiz-bang test back, you get the same generic vitamins if you didn't do the test. It's another fancy marketing ploy. Everybody's after $4.7 billion, and this is what happens. You talk about money, you must talk about Donald Trump. He lives down real close to where we are. He started multi-level marketing using urine testing. Same story, same thing, it's just a gimmick. But I like the fact that he said it's developed by experts. Blood serum has always been the gold standard for any physician. We believe in blood serum for every test. The truth is, it's no good for vitamin and mineral analysis because it's too short. Maybe you only get 2 days of history to serum testing. So if a person has taken their vitamins up in the last 2 days, we're going to get the false sense of security that they have a lot of vitamins in their system. It doesn't matter what's in the serum, it matters in the cells. And that's why serum isn't even effective. Almost every study you'll see today, clinical, is based off serum. And I say that's not a good way to go. In the medical world, we use hemoglobin A1Cs to monitor diabetics. If anybody's familiar, everybody's probably familiar with that. That's because it gives us a 3-month history of sugar load. I'm going to show you the next test, which is the exact equivalent in the vitamin world, only uses lymphocytes instead of red blood cells. It gives us a 4 to 6 month history of vitamin E. This is so irritating to me because it would be similar if you took your car to a mechanic and you said, my engine is making a funny noise and I want to find out what it is. So the mechanic has you pull the car in and says, okay, turn the car off. He goes around, looks in the gas tank and says, no worries, your gas tank is full. You say, well, wait a minute, how can you tell about my engine by looking in the gas tank? You see, I want to know what's in the engine, but plasma is the gas tank. What's the engine is the cells. We need to look what engine is if you're looking for trouble. This is the test, intracellular functional testing. It's a group out of Texas, University of Texas. They figured it out many moons ago. Rather than take a biopsy, they can use lymphocytes to get a view into the cellular life of people. Lymphocytes we draw blood whole, send it to them overnight. They grow the white blood cells and with a full media and get the rate of growth. They then use subtractive media, and they can determine when the cells run out of their natural amount. It's a functional cellular deficiency test. To me, it's the gold standard by far, because instead of me telling you what you need to take, yours tell us what they need. It's a big change. If you use this kind of testing and use therapeutic replacement, then you can really get some conclusions. Does it have an application? Yes. Doctors and neurologists work on brain trauma and sciatic nerve crush injuries, and they found that when they were looking at whether B12 might be helpful in the recovery phase, they found that the serum test said that the patient was fine. The truth is, they found out later the patient wasn't fine. When they gave B12, the patient started recovering. So making kind of clinical decisions off serum testing is not only wrong, it's dangerous. This is some unpublished data. I just pulled 22 people from our latest draws and threw their serum vitamin D against cellular vitamin D. The top line is the serum test. So you can see it. The top line is the serum test. The bottom green line is the cellular test. And these were the same patients drawn on the same day. We draw as part of our natural hormone panel to get a serum vitamin D. So we drew that, and then we did the functional cellular test the same day. So same patient, same time, same stick, and we compared the numbers. Anything under 30 is considered deficient in serum testing. Anything below 7 is considered deficient in cellular testing. As you look across the board, only the 22, only 3 were considered by the serum to be efficient. But when you look at the cellular components, 14 of the 22 are deficient. Well, you say, well, what's the big deal? Really, they kind of follow the same trend. When you look over here, this is very concerning. This patient has very high serum, but when you look at their cellular, they're completely depleted. This person was sent home saying, you don't need vitamin vitamin D. But in truth, they showed the lowest we've ever seen recorded in the cells. So this person was given false information based on an excellent test. The third, and I'll move along a little bit faster, is that nutrient codes matter. This body doesn't play games one finger at a time. You know, if you're looking at single nutrients, if you're trying to discover new vitamins and vital product, that's how that works. But when you're trying to look at symptoms and systems, you can't use single nutrients. Your body uses combinations, chords, to accomplish needs. Linus Pauling was one of the pioneers, who certainly everybody knows. He is a genius, like anybody's account. He believed in vitamin C therapy for many things. He believed it could cure heart disease, it should reverse heart disease. And he was never really nobody really ever felt that vitamin C was the answer. And never could figure out why. Because he really didn't realize that the vitamin C isn't the entire answer. You must use chords. We know for one thing from his work that vitamin C does not reduce or risk of prostate cancer. It does not prevent you from dying from prostate cancer because you died of prostate cancer. I put this in here because it's such a beautiful city. You know, this is just to emphasize that we don't want any one-note wonders. If you go to this beautiful place and listen to this beautiful group, they play in chords because that's what music and that's what life is like. A little silly humor. When you're looking for a needle in a haystack, you have 2 problems, a tiny needle and too much hay. It's true. When you're looking at symptoms and you're trying to reduce diseases, you must look with very, very keen eye, great science. If you look at thyroid health, we know this as physicians that you can't just add vitamin C and expect your thyroid to start functioning well because